20 years ago, the people of Massachusetts voted for better health and against big tobacco. It was a bold move, but something had to be done. 1 in every 4 adults in the state smoked, and the high school smoking rate was even higher, roughly 1 in 3. The ballot referendum asking voters to approve a 25-cent cigarette tax seemed doomed to fail. But a dedicated group of volunteers and professionals took on the challenge. As the Massachusetts Coalition for a Healthy Future, they led a 2-year campaign. At the forefront of the Question 1 ballot initiative was Dr. Blake Cady of the American Cancer Society, who became the chair of the coalition.
We knew that increased costs of cigarettes through taxation encourages people to stop smoking, especially kids. We knew that for every 10% increase, that purchases would decrease by about 4%, and kids would decrease smoking by about 7%. We realized that the revenues generated by the Question 1 tax increase would fund all sorts of health initiatives, especially media campaigns and tobacco cessation programs for kids, especially, but also for adults.
Led by the Massachusetts chapter of the American Cancer Society, the executive committee of the coalition included some of the state's most prominent health promotion leaders. Members included anti-smoking groups, health professionals, and legal and political consultants. They faced a formidable and better funded opponent, the tobacco industry.
So the tobacco industry funded a committee against unfair taxes. That was their story. They actually outspent what we had to spend by a ratio of more than 10 to 1. But we had a weapon they didn't have. We had people all over Massachusetts affected by tobacco, volunteers who were willing to get behind this initiative to tax tobacco and protect kids. They got involved in getting the word out at a local level, at a statewide level. They helped us get petitions signed, and ultimately the message tax tobacco, protect kids resonated with the public.
We held kids' press conferences at the State House. We mobilized the smoke-free class of 2000. We had news events, and we helped people in the community write letters to the editor. And with the help of hundreds of volunteers, we won the approval for Question 1 with 54% of the voters.
The victory led to the creation of the Massachusetts Tobacco Cessation and Prevention Program at the Department of Public Health. The media campaign, launched in 1993, was designed to galvanize public opinion around protecting children from the dangers of tobacco.
Last November, the voters of Massachusetts took a stand. They looked to the facts. They weighed the costs, the human costs, and they passed a cigarette tax.
We implemented a comprehensive program designed to reach all segments of society. Our objective was to prevent children from picking up the habit, to help smokers to quit, and to provide a clean environment for everyone.